radiology department in Tawam Hospital in Al Ain, United Arab Emirates. Welcome, Dr. Jamal. Microphone is yours.
Thank you, Dr. Rafat, for chairing this session. And also, I would like to thank Eco Microwave for sponsoring this academic and teaching activity. Also, I would like to thank Dr. Poland, who gave us an open arm in Antalya and gave us a training on the microwave ablation of the thyroid. So I'm a consultant interventional radiologist in the United Arab Emirates. This is where I practiced at Tawam and Al Ain Hospital. And I have been there for the last 15 years. I've done more than 50,000 IR procedures and more than 2,000 thyroid FNA. This thyroid FNA has started to help us now to recruit patients for the new procedure which we have introduced to treat the thyroid nodules, which is the RFA and the microwave. And I had the pleasure over the last 15 years to work under the flagship of Cleveland Clinic, Johns Hopkins, and VAMID, and currently under Saha. So I'll give you really our experience. How did we set up the service? So it's very, very important before you start, you have to love and to believe in this procedure. And also you have to get all the stakeholders involved in this setup, especially the thyroid surgeons and endocrinologists. Because really they are a very important part in the whole process in building the service and to refer the patient to you, and also you ask for their help if you get into a complication. So of course you have to go for training, formal training, and also workshops to get the knowledge and the hands-on to do the procedure, and then you come to your place and practice it. And very important, where we practice in the UAE, we have really very strict health authorities when it comes to mortality and morbidities and also complications. So we had to set up a clinical practice guidelines in our local hospital to draft the referral pathways and which patient should be treated by RFA and microwave. And after that, you have to, if you can't select your first cases, to do it safely, because you don't want a bad start. And then if you do a good case, really the patient will spread the word to his friends and his friends to other friends. And also your surgeon and the endocrinologist, they will start to talk positively about this new procedures. So this is really my first case. Unfortunately, it wasn't the best case to start with in terms of patient characteristic. So, but I did not refuse it because you wanted to start. So we started this case 17th of November 2021. This patient, he's a 78 years old patient. He's like a walking library, hypertensive, diabetic, coronary heart disease, dyslipidemia, and he has a toxic diffuse thyroid nodule. It's really huge. And also what makes things worse, he has ankylosing spondylitis. So very important to start up the service to have an interventional radiology clinic, because you have to see this patient independently and you assist them, you do the FNA, and you get the histopathology results, and you explain the procedure to the patient and their expectation. You have to be clear with them that this nodule will not disappear, so it will just shrink, and their symptoms or cosmetic effect will improve. And this is the, as you can see, the X-ray and the CT of this patient, and this is the size of the nodule. It's really huge, extending deep also into the thorax, all the way up in the neck. And he had this a huge goiter for the last 25 years. And because he's a very difficult patient and also high risk for intubation, so he's been abandoned from having surgery. He had compression symptoms, and also he doesn't like the shape of this nodule. Everywhere he walks, like in the street, and family, they ask him, what's this? I had no choice, so I accepted this patient. I felt sympathized with him, but I also deep in myself. I said I have to do it like carefully. So that was the ultrasound scan. As you can see, it's a huge nodule. So I said I'll start in the isthmus because he has also diffuse disease on the left and on the right side. So the isthmus is the symptomatic part. So very important is the setup of your procedure, really. So you have to find the position where your hands and your shoulders very comfortable, because also your hand to be steady during the insertion of the probe and delivering the microwave. So this is the patient. This is the nodule before treatment, and did local anesthesia around the gland and also hydrosection and started to ablate. It was really a good sized nodule, so you can ablate safely everywhere without like major risk of complication and reaching like a vital structures in the neck. So it was like a very good case to start with from this side of things. But again, it was a huge, so you ablate everywhere. It took me around like 10-15 minutes to complete the treatment of this session. This is immediately after the procedure. As you can see, the neck is red, hot from too many ablation in different direction. And you can see the hole is very tiny. So I followed the patient really. I give him a call every week and ask about him and check how is he. And this is the last picture which he sent me yesterday. He's really happy and satisfied about this result. It's more than 50% of the cosmetic appearance has improved within only 2.5 months. And as you can see, this is at the beginning, and this is after 1 month, and this is after 2.5 months. And I'm sure within 6 months, things will much improve. And actually, I received a message from him today. He's very happy and it's getting smaller and smaller. This is the second case, is different really. She's an Egyptian lady. She's 45 years old. She's visiting her husband in the UAE. She's based in Egypt, and she had a neck pain, and she wanted also neck mass, so she wanted to have ultrasound scan. They found this cystic nodule, which is good and ideal to start with. And so in cystic nodules, really, you have to aspirate the fluid. But before you aspirate the fluid, you have to place your microwave probe or needle inside it. Otherwise, it will just get displaced from the vital area which you want to ablate, because the nodule will collapse. So again, I still find like my way difficult. What's the best position for the patient, where to sit, on the right or on the left or over the head? But I think every patient is different, depends on the size and location of the nodule. And so I sat on the right side of the patient, and this is my colleague, Dr. Ala Al-Hakim, also was watching the procedure. Of course, you start by the local injection, and then you do the hydrodissection. As you can see, my fluid is going around the nodule to separate the carotid artery from it, and also to separate the trachea from the nodule. And then after that, I inserted the microwave probe into the distal part of the cystic nodule. And then I inserted another 18-gauge needle to aspirate the fluid. So the nodule collapsed. And these are the two needles inside the nodule. And then this is, you can see the aspiration and also the microwave needle in place, but not functioning. And then after that, I started to ablate. Of course, in the stepping shoot technique, from the deep and distal part to the superficial part. And I did around 35 cycles on this lady safely, and it took around 4.5 minutes. And because I gave a very good local anesthesia, she did not suffer of like severe pain. Usually, the pain threshold in our like sister Egyptian ladies and or Egyptian in general is much lower than the other nationalities. But she did very, very well and without any problem at all. And we completed the treatment. This is like for 4.4 minutes of microwave ablation. And as you can see, this is after completion of the treatment. So the whole nodule is hyperechoic. from the ablation, and it went very well. So also like your team around you, so they have to be like familiar with the procedure to get training on the machine and the setup. Also after the procedures, very important, the ice pack on the neck. And this is the message I received from the first patient today. السلام عليكم, حجم الغدة تقلص بشكل ملفت. بارك الله فيك, تسلم لي. This is really very, very rewarding for me. So that guy, he's been suffering from that huge nodule for the last 25 years. He's feeling much better about it. It's really rewarding. So really, like for us with this procedure, we feel like we are giving another lifeline for patients with benign thyroid disease who don't want to have half of their thyroid being chopped off, or sometimes total thyroidectomies. But I'm sure that therefore with our thyroid surgeons and actually some of our colleagues here, they started to offer the procedure part of their consultation with patients with benign thyroid nodules. And this is really our local distributor for the microwave machine which we use. They are very important in organizing the trip for the training, and that was really very useful. Thank you very much.
Thank you, Dr. Jamal. Thank you very much for the nice cases. I think we can move now to the